Hey everybody, welcome back to Dental Unfiltered. I'm Matt Brown. I'm here with my normal co-host, Dr. Andrew Vallo. Today we have a really interesting episode for you. Andrew's group has grown pretty significantly, and as groups grow, you change the way you do things. You build new infrastructure. Your processes today are different than yesterday. Andrew is recently 100% out of the chair, full-time CEO, and really cool subject we're talking about today. I thought was worth an episode was he just hired his first chief hygiene officer. So somebody totally in charge of quality of hygiene and hygiene procedures and processes and bonuses. And, I never, when he said it, I'd never heard of the position of a chief hygiene officer. And, I'm new to dentistry only 4 years. That makes sense. And we started explaining it. I was like, man, this is something that I think we should be worth talking about. So, Andrew, you just went about getting your first chief hygiene officer for your group. Your group's growing. You're going to end the year this year with 7 or 8 practices. So, what was it like that made you realize you needed this position? Because it seems like sometimes in dentistry, we grow and do things and grow and do things. Sometimes the personnel is limits our growth, and we don't recognize the need for the personnel to get the growth. You're pretty good about that because you hire ahead normally. You're normally hiring for where you want to be, not where you are, which is smart. So what was the thing that was like, oh, I need a chief hygiene officer?
Yeah, this is going to be a cool episode, guys. I'm sure many of you do not have a chief hygiene officer, or may not have even heard of the term before. I know I hadn't not too long ago. To Matt's point, I'm constantly asking questions about who my next hire should be. Who I should bring on the leadership team. When I go to my mastermind meetings, we sit in the hot seats. I'm often talking about, when am I bringing in this regional manager? When am I doing this? That was kind of the how I got started with the executive assistant operations officer. So the way that I learn things, guys, is I ask questions. So I talk to people who either have grown large dental groups or have worked with people that have grown large dental groups. I get a lot of my advice, honestly, from my CPA group. So, there are CPAs. They do our monthly bookkeeping as well as our taxes, but they also kind of serve as a consultant, more or less, because they work with a number of emerging dental groups, and so they've got good advice on next steps that I've got to take for my group, and that's actually where I got this recommendation from. So technically, so
Who
Janet,
we use the same company as the CPA. Who are you using for
yeah,
CPA?
yeah,
Who we plug them?
Patrick,
Patrick, yeah. Patrick
yeah.
Arnold
So
at what it
Pat at Elliott Davis, yeah,
Davis.
Patrick
We use
Arnold.
them too. We like them a lot.
Yeah. Oh, Patrick is a great guy. I mean, I've got his cell phone number, which I'm sure he probably regrets sometimes, but like I could text him
I
at
got cell phone number too.
7:30 at night and be like, "Hey Patrick, I've got an important question," and like he'll call me. I mean, like he's always there to help me out and give me advice. And I mean, like we strategize with them as far as the growth of the group and new practices and associate equity and like just all kinds of cool stuff. So guys, I guess the lesson of that is if you're trying to grow a larger practice or a group of practices, that accounting is more than just accounting. It's also strategy, and having an experienced like dental team to help you with that stuff is super important. But anyways, Patrick has introduced me to different people over the years, and he introduced me to Janet Hagerman. Um, so she's technically like a fractional chief hygiene officer right now, which basically means like part time. Essentially, she's a consultant. So she was a hygienist for a number of years. She then was hired as the chief hygiene officer for a larger group that had over 100 practices. And essentially, she was in charge of the hygiene department and the protocols and the systems and the efficiencies and the KPIs for this larger group. And then she has since gone into her own kind of consulting. And so essentially what her role is, she comes in and, she meets our hygiene team. She does monthly mastermind coaching calls with each of our hygienists. She does group meetings and group calls. She sets up, doctor hygiene meetings. She sets expectations and consistencies, when it comes to our perio protocols and our KPIs. Um, and like, her kind of responsibility to our group is we want to see, our hygiene department grow. We want to see them become, better at treating patients, with perio disease, better with treatment acceptance and diagnosis, better with our pre-appointment rate, better with adjunct services like fluoride. And she's also helping the hygienists, when they have issues or concerns, trying to help them troubleshoot, solve problems, whether it has to do with scheduling or just like their approach, to discussing perio with patients. And so she's kind of there to lead our hygiene department, lead our hygiene team, serve as one of the leaders for the organization. And her long-term goal is actually to find a hygienist on our team that has the desire to essentially morph into this role. And we don't know exactly when it's going to be, and we don't know, if it's going to be full-time, part-time. But eventually, we would like to take that chief hygiene officer position internally versus external with a consultant. So that's kind of the long-term roadmap that we've got working with Janet right now.
So your team obviously knows you got this chief hygiene officer, right? Is so another culture at your practice is your team's ready for change all the time. Your team just knows change is coming.
Well, I don't
Because
know if they're ready for it per se,
but
but
they're more
they're
ready than
probably used to it by now.
they're
I
used
would
to it now. They're
suggest.
conditioned to it, right?
Yeah.
So when you first introduced this concept, 'cause you have how many hygienists do you employ total? 20?
Currently, at the 4 offices that are open, we've got 5 full-time hygienists and 1 part-time hygienist. So I guess 6 total. And then we've hired a full-time hygienist for one of the new practices, and then we are hopefully hiring another one soon. So we'll soon have, I guess, 8 total hygienists in our organization.
So hygiene's like its own little tiny practice of itself, right? So how
Yeah.
what was the reception like from the hygiene team when you told me you're hiring this person?
Yeah, so we kind of introduced her at our first annual company-wide summit. She gave a little speech, and then she got to do a smaller introduction with our hygiene team, and I feel like she was very well received. Obviously, anytime you're trying to make changes, it can be tough. Anytime you're trying to change policies, again, I think the main issue here was that we didn't have consistency with our protocols when it came to hygiene and perio. We didn't have clear expectations. Everyone was kind of doing things a little bit different. We didn't have calibration where it should be. And the sad part was, honestly, I had tried, and I'm not saying that I couldn't have given more effort to those things. But I can't, I think it can be tough sometimes when it's coming from, inside the doctor, the owner, whatever it is, because we've discussed some concepts and ideas, and I felt like I had buy-in, but it didn't always necessarily happen the way that I had hoped or thought. So I think having an external source come in who was a hygienist, was in their shoes, did the same things they did. Because sometimes, if you try to tell one of your team members, a hygienist or an assistant, like, hey, this is how we want to do things, like their reaction is, well, you just don't understand, doc, because like you haven't done this. And I mean, no, honestly, like it is
Yeah,
totally
it
fair.
happens.
It's totally fair because
No, it's
I
definitely fair.
haven't done that. I have never been a dental hygienist. I've never done any hygiene within our office. So while I, the dentist, created or try to create the protocols and the scheduling and the blockouts and everything else, to their point, I had never done that before. Well, Janet has. So, when we're trying to make these changes and they say, oh, like you just don't understand, Janet can say, I do understand. I was in your shoes. I did have to deal with these challenges. I do understand the struggle that you're going through with this. This is how we can make it work. So I think that is really impactful. And I think for any practice, it doesn't necessarily have to be on an ongoing basis. You don't have to necessarily bring in a true like chief hygiene officer to try to like run the program for you. But just even bringing in a hygiene consultant, like somebody that was a hygienist, that was in your hygienist shoes, that's been successful. I just feel like it can sometimes they can sometimes relate a little bit better, and I think it can breed a little bit more confidence in your hygiene team that like this truly is possible, this is plausible, this is realistic because the person asked them to do it has done it themselves.
Well, I think it's like, I can understand, kind of that point of view. Like, I'll be on a Zoom call with a dentist and I'm like, hey, you got to do free consultations. And they're like, whatever, dude. And then I get like you or like Fran Dolan or someone who's in the community who's a dentist, talk to them and like, oh no, you need to do free consultations. And I'm like, oh,
Yeah.
okay, the dentist knowledge,
Yeah.
good.
Yeah.
Like,
Exactly.
it's you know, part of it is like my former background in the special operations world. Part of my time there, I wasn't a team guy or anything like that. I worked in the combatives room, teaching combatives and fighting in small rooms and stuff. I'm telling Green Berets how to do things, and they're kind of like, "You've never ran a live mission." It was just true, but I was an expert in hand-to-hand combat, and that's kind of my thing, right? So it's like, you know, there is of like you can say the same things, the same exact things, word for word, right? But I'm willing to receive the information from someone who's been in the scenario because I draw a level of security from them knowing the challenges of what I did in that job. I think that's very worth respecting as a leader, and I think sometimes leaders get like they take it insultingly, like, well, no, respect it. Like they want to hear it from somebody who is their, you know, their colleague or they're doing their job because they know that they understand and respect the challenges that come along with it.
I think you're absolutely right, man. And I see the same thing sometimes like with our implant docs, you know, it's like I try to tell them how we want to do something, you know, not necessarily from a true clinical standpoint, because that's not my niche, but maybe from a scheduling or, you know, lab or whatever it is. And, you know, because I don't have that same experience, you know, with placing implants, I think they kind of get the same, you know, reaction sometimes. It's like, yeah, but you just don't quite get it because you haven't done it. You haven't, you know, you haven't been in the trenches, you know, with this. But then my partner can go say the same exact thing to them. You know, he's a periodontist. He's done so many of these advanced surgeries, and I think it's better received coming from him. So I think for all of us, there is some level of that where that, you know, if you can relate to that person, if you know that they have done exactly what you're doing, you're going to be more apt to listen to them. I think it's also the idea sometimes with like consultants who aren't dentists. I think sometimes it can be tough. You know, like, oh yeah, that sounds great on paper, but like you're not a dentist. Whereas sometimes like when you listen to people like Mark Costas who built his dental group, it's a little bit easier than to be like, oh yeah, okay, Dr. Mark did this, so you know it must truly work. So I think there is some level of, you know, credence that should be given to that. Um, I think, you know, again, at the end of the day, we've talked about before, there can be splits, I think, between dentists and hygienists sometimes. Sometimes we feel like we're on different teams when we're really on the same team. And honestly, when I met with Janet to have our initial conversations about some of the goals, you know, for the hygiene team, I think she and I were on the same page with a lot of stuff. So it wasn't like she came in and she's like, "Oh no, Dr. Vallo, like everything you're trying to do, like that's not how we should do things. Like this is the more effective way." I mean, she obviously brought some great ideas to the table as well, but I feel like for the most part, we were on the same page. Like we're speaking the same language, we have the same ideas, we have the same expectations. But it's just it means something else, I think, coming from her than necessarily coming from me. So
Yeah, I think part of it too is like, so I think on the other side of it too, though, sometimes when an outsider comes in who doesn't have that on the ground grassroots experience, they can sometimes bring a fresh perspective also, even though they're not the operator on the front lines
yeah,
of it.
oh yeah, for
That
sure,
really is a high value as well, right? I
absolutely,
think when those knowledges come together, I think the two can really guide each other. So getting back to the instituting a chief hygiene officer, right?
yeah,
So you have an emerging practice. You know, the guys at Elliott Davis are like, hey man, it's time for chief hygiene officer. Really good sage advice, right? They give it to you. So now I'm a dentist. I go out there and find this chief hygiene officer, right? Me as a dentist, when I seek this, what am I expecting out of a chief hygiene officer to improve my hygiene department and my emerging group? Like what should I be looking for and expecting out of that individual?
yeah. So you know, obviously, we've talked about it many times. We use dental intel, so you know that's a good way for us to track our KPIs. You know, especially when it comes to hygiene. So again, things like perio diagnosis percentage, perio visit percentage, perio acceptance percentage, fluoride percentage, reappointment percentage for both hygiene and new patients. Like those are all great metrics to look at. And so like those are some of Janet's goals. I mean, guys, again, no matter what study you look at, over half of the people in America have some form of periodontal disease. So, I think that is one of the lowest hanging fruit in a lot of offices that goes underdiagnosed, underaccepted. A lot of offices are doing 10% perio visit, 15%, 20%. So not a lot of are they're doing less than 10%. So, periodontal treatment, we know how important it is. At this point in time, we know the studies that are linking the bacteria that are present in periodontal disease to things like diabetes, increased risk of heart attack and stroke. I think the strongest link of anything is Alzheimer's. Some of these studies
Oh, really?
I've read. Oh my God, yes. Some of the studies I've read on the link between Alzheimer's and periodontal disease like blew my mind. Like it was like some of these studies are almost conclusive that like periodontal disease in the back, specifically spirochetes, if we're going to get into the nitty gritty, but the bacteria that are present, oftentimes in periodontal disease, are like the strongest link to a predisposure to developing Alzheimer's later in life. So, again, guys, a lot of our patients aren't educated on this. And I think it can be a hurdle for both hygienists and dentists sometimes because patients, come in, either one, they have been going to another dentist and now they're switching dentists and their old dentist didn't really diagnose perio. So they were doing bloody prophies for years. And all
Yep.
of a sudden, you're telling them, hey, you've got this gum disease that, no one's ever told you before. And we need to do treatment. It's going to cost significantly more. So like that can be a hurdle. Or it's a new patient who doesn't have insurance and they haven't been to the dentist in years and they have periodontal disease and they're coming in for some new patient special you have, and all of a sudden you're telling them, hey, you don't need a dental cleaning, you need this treatment and it's going to be $1,000, $1,200, whatever you guys charge for 4 quads of SRP. I think that's a major hurdle. I think dentists and hygienists are sometimes afraid of making patients upset. I think sometimes we think we're doing them a favor by, kind of being like, oh, it's not that bad. It's borderline.
No.
We're going to just keep an eye on it. We'll just do a regular cleaning this time, or maybe a scaling the presence of inflammation. And we'll kind of see how it, what happens from there. But again, guys, if this is a patient who hasn't been to the dentist in years and years, and they come in this one time for the special and you do this, thinking you're helping them out, bloody mouth prophy, and like, they may not come back for another 5 years or 10 years. And if the condition was like just kind of bad right now, imagine what's going to be 5 or 10 years from now when we didn't even do the treatment they really needed. So we can't be scared. It's our duty. It's our job. It's part of our job as both dentists and hygienists to, tell patients what concerns are there in their mouth and to educate them. I am really big on making sure that we do fully educate patients on what gum disease is. It's an infection in your gums, dangerous bacteria. We now know that it's been linked to increased risk of some really bad systemic diseases like diabetes and heart attack and Alzheimer's. So we're not just worried about the health of your gums and the bone. Obviously we want your gums to be healthy. We don't want you to lose bone around the teeth because that's the silent killer of teeth. You may never have a cavity your whole life and can still lose your teeth and end up in dentures because you have untreated periodontal disease. So like, very important stuff, but even more important is your whole body health and making sure that you've got lower risk of developing these horrible chronic diseases. So
Yeah. So you're hiring this chief hygiene officer, and obviously, like all the clinical stuff's really important stuff. I didn't know about the link between periodontal disease and Alzheimer's. There's a link, a lot of link between sugar and diabetes and Alzheimer's too, which kind of all kind of links together, right? Like it all kind of makes sense. Like it's all there. So we're hiring the chief hygiene officer. It's probably a big investment in the group, right? So what are the performance metrics you're looking at, and where do you want, like, what is the performance increase you're looking to get out of your hygiene team now from them, and what tools you use, like bonuses, performance based pay, like how are you? What is the driving force for those things?
yeah, so there's a number of different things that we're looking for. Our goal is that we want to ensure that we are actively looking for periodontal disease. Like that's you're not going to find what you're not looking for. We had a conversation about it, Janet and I and the leadership team the other day, and I said I feel like we are assuming everybody who comes in doesn't have periodontal disease until we find that evidence that they do. And oftentimes, I don't think we're doing a very good job looking for it. And I said, I feel like we should be doing it the other way around. I feel like when patients come in, knowing that over half of Americans have periodontal disease, we should assume that disease is there until we check the boxes and find that it's not there. So I think it's kind of that mindset shift that we're trying to work on. That's part of it. We do want to see improved metrics. I know we're missing diagnosis, so we're trying to make sure that we're improving our diagnosis of periodontal disease in the office, and then just other things like I said, like fluoride. I know fluoride's a controversial topic these days, and even more is in the news now. But everything that I have read, all the studies I've read, in proper doses, fluoride is completely safe, and it is the best preventative measure against decay, the best way to help you keep your or extend the life of your existing crowns and fillings. Helps as a desensitizer. So I personally use fluoride every single day. It's in my toothpaste and mouthwash. I get fluoride treatments when I have my teeth cleaned. We should be encouraging all of our patients to have fluoride treatment done. And at the end of the day, just like anything else, it's up to them. But it's our job to educate them. It's our job to let them know, hey, just like anything else, studies have shown in the right dosage, it's completely safe and it has all these benefits. So in my mind, the benefits of fluoride outweigh any of the risks. And that's what I'll tell patients. And there are some patients who are never going to do it, and that's totally fine. But again, we should be offering and encouraging it to everybody. So that's something else that they're working on. And then pre-appointment, actually, we had a conversation with Kelly Schwartz about this. Him and I see it differently. And again, it can vary depending on the stage of your practice. But if you're in growth mode, you want everyone pre-appointing their hygiene appointments so you can continue to grow that hygiene department, that recall cycle, add more hygienists, whatever it is. So I want all of our patients pre-appointed for their next cleaning, even if they don't know their schedule 6 months from now. So like we work with the team on verbiage to help get their patients scheduled while they're in the office, so we don't have to try to follow up with them, after the fact. So that's some of the stuff that, she is helping us work on with the hygienist, and she is basically reporting back monthly. And she's only been doing this for, I think about a month and a half, 2 months now, but she is making monthly reports as far as what the numbers look like, where areas are improving, things that are still a struggle, things that still need attention. And then again, she's doing those monthly individual calls with each of our hygienists and doing the group meetings. But I think that the last big piece of the picture is getting our hygienists and our doctors calibrated. So it's having those doctor hygiene meetings, and she wants the team to have those at least twice a month, where they're going over some cases together. They're talking about X-rays and IO pictures and probe depths and specific patient cases. We want our hygienists and our doctors to be a great team where they're helping each other out with co-diagnosis. The hygienist should be warming the patient up and discussing things like periodontal disease and restorative needs, and then the doctor should be coming in, kind of doubling down on those things. So it's they need to be there to help each other out with that co-diagnosis.
So we're gonna wrap this up here in a second. I just want to ask you one question. So Andrew Vallo, pre-practice one, we first met, and from day one, you were building a group. Like before you had first piece of construction done in building one, you were building a group, right? And the whole time, I know you've been thinking, you think so far ahead. I mean, you think like you're at 8 practices now, you're thinking like 50. I know how you think. And you thought like my C-suite or my leadership team was going to be X, and now it's this. And Chief Hygiene Officer is something that we never even talked about. Like it's something you never even thought of until now, right? How much has the perception as you've grown of what your C-suite or your leadership team is or should be compared to what you thought it would have been back when you first started thinking about this stuff?
Sorry, I had muted because the dogs were barking at someone at the door. Yeah, that's a good question, Matt. I think when I first was planning for some expansion, I always knew that we would need a leadership team. I don't think I quite had a full grasp of what a leadership team was and the different positions that we'd need on it. I think maybe early on, I kind of figured I'd be the leader of the group, which I still am. I'm CEO of our group. And I figured, we'd maybe have like a regional manager or operations officer or something. But I don't think I realized all the different little pieces, and there's still more to come. So, at this point in time, again, we've got myself as CEO, we've got my father as our CFO after all of his years in banking. We've got my brother as executive assistant. So, we truly are a family-owned, growing business here. We've got Manny as our operations officer, and he's kind of my right hand guy when it comes to all the day to day stuff that needs to be done. He's kind of doing a hybrid role of operations and regional manager, kind of doing a lot of the HR stuff as well. So, the next piece of the puzzle, well, and then obviously as we're talking about today, the Janet, our consultant, our fractional chief hygiene officer, which eventually should become a full-time role as the practices continue to grow. But, regional manager we'll be bringing in sooner than later, probably as these next round of practices open. And then eventually we'll have multiple regional managers as we're expanding our footprint in Florida. Clinical directors. So, I think eventually Sasha is probably going to morph into the clinical director role for our implant side. He's essentially kind of doing that role now, but as he cuts back at it with his clinical dentistry, he's probably going to morph into more of a full-time kind of role there as the implant group continues to grow. And then eventually we'll probably want a clinical director for the general side as well. And I don't think that's going to be me. I don't really see myself doing both the CEO and the clinical director role. So we'll probably have to bring somebody else in, or potentially one of our docs that's already here. But yeah, guys, I mean, leadership team is huge. There's no way I could do all this myself. I mean, even with a great leadership team, it's challenging. So I think that is my biggest advice. And actually, we talked with Fran about this, when we had him on the podcast yesterday. Is that as you continue to grow, you need to take more and more things off your plate, and you need to surround yourself by more great leaders. That's the only way that you can continue to grow predictably, efficiently, and not run into a whole bunch of fires that you're putting out every single day.
All right, guys, well, it's time to wrap this up. This is a really cool episode. Chief Hygiene Officer is something that I never thought of, and it all makes perfect sense now, and it's pretty awesome. Hey, guys, me and Dr. Vallo don't do this for money. We don't get sponsorships. We don't sell airtime. Please click like, subscribe, and follow. It's that's what's rewarding to us, is seeing the reviews and seeing the feedback. Thank you guys so much for making time for us, listening to us today. Have a wonderful day, and thank you so much for being a great audience.